I've been a night shift nurse for 9 years. Memorial Regional Hospital, Arizona. Christmas Eve, 2016. The kind of night where every call button feels like it's going off at once. Room 412 was a routine check. Mr. Gerald Foley, 78 years old, post-operative day 3 following a successful hip replacement. Stable vitals all week, walking with assistance, eating solid foods. Insurance had already approved his discharge for the day after Christmas. The floor was chaos that night. 18 patients, 3 nurses, 1 aide called in sick. I was juggling medication rounds, 2 post-surgical drains that needed monitoring, and a family in the waiting room who wouldn't stop asking questions. But Mr. Foley had been easy, quiet, polite. Pressed his call button only when absolutely necessary. His daughter visited every afternoon, brought him crossword puzzles. He'd been a high school math teacher for 40 years, still sharp, still present. I checked on him at 10:15 p.m. He was asleep. Vitals on the monitor looked perfect. Heart rate 68. Blood pressure 118/76. Oxygen saturation 98%. I adjusted his blanket and left. At 11:40 p.m., I came back for the midnight vitals check. Standard protocol. Every 4 hours for post-operative patients. I knocked softly. "Mr. Foley? Just checking your blood pressure." No answer. Normal. He was probably asleep. I pushed open the door. The room was dark, except for the glow from the monitor above his bed. That soft green light that casts everything in a sickly shade. The IV pump humming its rhythmic beep. The oxygen concentrator whirring in the poner. Mr. Foley was awake, sitting up slightly. His eyes were open, fixed on the far corner of the room. "Mr. Foley." I flipped on the small exam light above his bed, not the overhead, too harsh. "How are you feeling?" He didn't look at me, just kept staring at that corner, by the window, where the visitor's chair sat empty. "I'm just going to check your blood pressure, okay?" I wrapped the cuff around his arm, hit the button. The cuff inflated with that familiar squeeze and hiss. That's when he spoke. "They're watching us." His voice was barely a whisper, dry, scratched. I looked up. "Who's watching us, Mr. Foley?"
He didn't move, didn't blink, still staring at that corner. "Over there," he said. "In the corner. Can't you see them?" I followed his gaze. The corner by the window. The visitor's chair. Empty. The curtains were drawn. The window showed nothing but darkness and distant city lights. "There's no one here, Mr. Foley, just you and me." The blood pressure cuff beat. I looked at the reading. 122/78. Perfect. Maybe slightly elevated from his baseline, but nothing concerning. "I can see them," he said. His voice hadn't changed. Still flat. Still whispered. 3 of them. Standing right there. They've been there for an hour. I felt the temperature in the room shift. Or maybe it was just me. I glanced at the corner again. Really looked this time. The shadows there seemed darker, thicker. The kind of darkness that happens when the light doesn't quite reach. But it was just a corner, just empty space. Mr. Foley, you might be experiencing some confusion. That can happen after surgery. The anesthesia. I'm not confused. His eyes finally moved to me. Clear, focused, completely lucid. I know what I'm seeing. They're waiting. Waiting for what? He looked back at the corner. For me. My skin went cold. I've heard confused patients say strange things, dementia patients, patients on heavy pain medication. But Mr. Foley wasn't on anything stronger than Tylenol. His cognitive function had been perfect during every assessment. I looked at his monitor. Heart rate, 70. Oxygen, 98%. Everything normal. Let me get your temperature, I said, trying to stay clinical, trying to follow protocol. I scanned his forehead with a temporal thermometer. 98.4 degrees Fahrenheit. Normal. Mr. Foley, your vitals look great. You're doing really well. Is there anything I can get you? Some water? Do you need pain medication? He shook his head slowly, never taking his eyes off that corner. They're closer now. I looked again. I couldn't help it. And for just a second, maybe it was the angle of the light, maybe it was exhaustion, maybe it was nothing. I saw it. A shadow, darker than the others, tall, standing in that corner where the light from the monitor didn't quite reach. My breath caught. I blinked. It was gone. Just a corner, just darkness. I'm going to call the doctor, I said, just to be safe. Have him come check on you. It won't matter. Mr. Foley's voice was calm, resigned. They're here for me. I can feel it. I backed toward the door. I'll be right back. I stepped into the hallway. The bright fluorescent lights felt like a slap. I could hear the hospital sounds again. Call buttons, distant conversations, the elevator dinging. Real, normal, safe. I pulled out my phone, called Dr. Hammond. He was on call. Explained the situation, possible post-operative delirium, visual hallucinations. He said he'd come up. I checked the time, 11:48 p.m. I was gone maybe 90 seconds. When I walked back into room 412, the monitor was screaming. That long, single tone, the sound every nurse knows, the sound that means only one thing: flatline. Mr. Foley was still sitting up, still positioned exactly how I'd left him, but his eyes were closed now, his head tilted slightly back, his mouth open. No breath, no movement. I hit the cold blue button, rushed to his side, felt for a pulse, nothing. Mr. Foley! I lowered the bed, tilted his head, started compressions. Code blue, room 412, code blue! The team arrived within seconds. Dr. Hammond, 2 other nurses, respiratory therapists. We worked him for 18 minutes, intubated, epi, compressions, shocks, nothing. Dr. Hammond finally called it 12:11 a.m. Christmas morning. Time of death.
The autopsy showed nothing. No cardiac event. No pulmonary embolism. No stroke. No internal bleeding. Nothing that would explain sudden cardiac arrest in a healthy, stable, post-operative patient. Cause of death, undetermined. His daughter came the next day to collect his belongings. I helped her pack his clothes, his crossword books, his reading glasses. "Did he say anything?" she asked quietly. "Before he
before it happened?" I hesitated. He seemed peaceful. I didn't tell her about the corner, about the shadows, about what he said he saw. But as we were leaving the room, she stopped at the doorway, looked back at that corner, the empty visitor's chair, the drawn curtains. "He was always sensitive," she said softly. "Even when I was little, he'd know things, feel things. He told me once that his grandmother came to him the night she died, stood at the foot of his bed, didn't say anything, just waited." She looked at me. Her eyes were red but dry. "He wasn't afraid at the end, was he?" I thought about his face, that calm resignation, the way he'd looked at that corner like he was seeing old friends. "No," I said. "He wasn't afraid." After she left, I went back to room 412. It had already been cleaned, bed stripped, monitors reset, ready for the next patient. I stood in the doorway, looking at that corner, the visitor's chair, the window with the curtains pulled back now, letting in the gray morning light. Just an empty corner, just a chair, just a room. But I haven't been able to take that assignment since. Room 412. Other nurses cover it now. They ask me why. I tell them it's nothing, just preference. Because here's what I can't stop thinking about. Mr. Foley's vitals were perfect, right up until they weren't. No warning, no decline, just alive, them not. Like something had been waiting, watching. And when the time came, whatever was in that corner didn't have to do anything violent or dramatic. It just collected what it came for. I still work night shift, still check vitals every 4 hours, still walk into dark rooms with only monitor glow to see by. But now, when patients tell me they see something, someone in the corners of their rooms, I don't dismiss it as confusion anymore. I just check their vitals very, very carefully. And I make sure I never turn my back on the shadows, because sometimes the darkness isn't empty. Sometimes it's full.
I've been an ER nurse for 12 years. St. Catherine's Medical Center, Massachusetts. Christmas Might, 2017. The kind of shift where you're running on coffee and muscle memory. Holiday nights are always unpredictable. Families fighting, drunk drivers, heart attacks from too much stress and standing rib roast. By 11 p.m., we'd already seen 8 patients. I was the charge nurse. Trauma Bay 3 was mine. The call came in at 11:47. Dispatch said EMS was bringing in an unresponsive male, mid-40s, found collapsed outside a church on Berkshire Avenue. No ID, no wallet. Temperature was 19 degrees that night. They suspected hypothermia or exposure. I prepped the bay, IV stand ready, warming blankets, cardiac monitor. Drew up emergency medications,
Atropine, epinephrine, just in case. Dr. Reese was on duty. Good doctor. 15 years trauma experience. She was finishing with a laceration in Bay 1. The ambulance arrived at 11:53. I heard the wheels before I saw them, that distinctive sound of a gurney rattling through automatic doors. 2 paramedics. The older one, Steve, I'd worked with him before, was doing compressions. The younger one was bagging. Standard CPR protocol. No pulse at the scene, Steve said as they wheeled past the nurse's station. Started compression 6 minutes ago, 1 round of epi, no response. They transferred him to our bed. I got my first real look. White male, maybe 45, 50, dark hair going gray at the temples, wearing a brown jacket, jeans, work boots. His skin was pale, that waxy bloodless color, but not blue, not mottled, just absent of color. His eyes were closed, peaceful almost, like he was sleeping. I said, "Let's get him on the monitor. Start a second line. Someone page Reese." We worked fast. Lisa, another nurse, cut away his jacket. I got the cardiac leads attached to his chest. The monitor beeped to life. Flatline. Complete asystole. No electrical activity at all. Steve was still doing compressions. Found him on the church steps. Face down, no trauma, no obvious cause. How long was he down before you got there? Unknown. Anonymous 911 call. Caller didn't stay. Dr. Reese came in, pulling on fresh gloves. What do we have? Unresponsive male. Asystole. No pulse, no ID. Possible hypothermia. She moved to his head, checked his pupils with her penlight. Pupils fixed and dilated. She felt his neck. Cold to touch. Let's get a temp. Lisa inserted the thermometer. We waited. The number came up 89.2 degrees Fahrenheit. Severe hypothermia, but survivable. I'd seen colder patients come back. Continue compressions. Dr. Reese said, "Get warming blankets on him, warm IV fluids. He's not dead until he's warm and dead." That's the rule with hypothermia. The cold can protect the brain. People have survived hours in cardiac arrest when they're cold enough. I grabbed the warming blankets from the cabinet, turned my back for maybe 5 seconds, 10 at most. I heard the monitor still beeping, heard Steve counting compressions, heard Lisa adjusting the IV flow.
I turned back around with the blankets. The bed was empty. The leads were still attached, dangling. The electrode pads stuck to nothing. The IV line was pulled out. A small drop of blood on the white sheet where it had been in his arm. But the patient was gone. Where? I couldn't finish the sentence. Steve stopped mid-compression, his hands hovering over air. What the hell? Dr. Reese looked up from her chart. Her pen stopped moving. The 3 of us just stood there, staring at an empty bed. The cardiac monitor still beeping. The oxygen mask lying on the pillow where his face had been 30 seconds ago. Did someone move him? Lisa's voice was small. No one came in. I was looking at the doorway. No one went out. Check the bathroom, Dr. Reese said, but her voice had changed, thin, uncertain. Steve pulled back the curtain around the bay.
Empty. The bathroom door was open. Empty. The supply closet empty. This isn't possible, I said. He had no pulse. He was hypothermic. He couldn't just... Security. Dr. Reese was already at the phone on the wall. Get me security, now. 2 guards came up within 3 minutes. We explained. They looked at us like we were insane. I understood. I would have looked at us the same way. They checked the cameras. Every ER entrance and exit has cameras. Hallways, waiting rooms, ambulance bay, everything recorded 24/7. The security office was 1 floor down. We stood behind the guard at the monitors. He scrubbed through the footage. 11:53 p.m. Ambulance arrives. Patient wheeled in on gurney. Clear as day. We watch ourselves transfer him to the bed. The camera had a perfect angle on Trauma Bay 3. You could see the bed, the monitors, all of us working. 11:58 p.m. I turn around, walk to the cabinet. My back is to the bed. 5 seconds, maybe 6. The patient is there on the screen, lying flat, Steve's hands on his chest, Lisa adjusting equipment. Then I turn back around, and on the camera, just like in real life, the bed is empty. No one walks out. No one carries him. No shadow, no movement. He's just there, 1 frame. Gone, the next. Rewind it, Dr. Reese said. The guard did. We watched it again. Slower this time. Frame by frame. The patient is on the bed. Steve is mid-compression, his hands pressing down on the man's sternum. I can see the chest compressing under Steve's palms. Next frame. His hands are still in the same position, but they're pressing down on nothing, on air. The man underneath has simply ceased to exist. No blur, no fade, no movement, just presence, then absence. That's not possible, the guard said. He sounded scared. Steve was staring at his hands. I felt him. I felt his ribs, his sternum. He was solid.
We filed a report. Missing patient. Unknown male. No identification. Security alert sent to every floor. Police were called. They searched the hospital, every room, every closet, every stairwell. Nothing. No one matching his description left the building. No one matching his description was ever admitted. The anonymous 911 call that reported him, the number was disconnected. Hadn't been in service for 3 years. The church where he was found, St. Augustine's on Berkshire Avenue. I drove past it 2 days later. Couldn't help myself. I talked to the priest. Christmas night, he said. No, we didn't have any service that late. Church was locked up at 9 p.m. Someone was found on your steps, collapsed. He shook his head slowly. The steps were clear when I locked up. I walked right past them. I went back to work. Kept working, kept doing compressions on patients who needed them, kept turning around to grab supplies. But now, every single time I turn my back on a patient, even for a second, there's this moment, this tiny, terrible moment where I think, what if they're not there when I turn back? Most of the time they are. They're always there. Stable or crashing, alive or coding, they're there. But I know what I saw, what we all saw, and here's what keeps me up.
That man's body temperature was 89 degrees. Severe hypothermia. But he wasn't shivering, wasn't showing any of the signs. His skin wasn't blue or mottled. Because when you're dead, truly dead, your body doesn't try to warm itself anymore. So maybe he wasn't hypothermic at all. Maybe he was just cold. I still work in that ER, still take trauma bay assignments. Bay 3 is still active, still treats patients every night. But sometimes, late on Christmas shifts, I catch myself staring at that bed, at the space where a man once was, where a lead still dangled, where an IV dripped into nothing. And I wonder, if he could vanish like that, impossible as it is, then maybe he was never really there at all. Or maybe something else was looking back at us through his closed eyes. Something that decided in the space between one heartbeat and the next that it was time to leave. The bed's never been empty since, but I still check every single time, just to be sure.